Are you using Ozempic, Mounjaro, or similar drugs? And did you know there's a side effect that you may not be aware of? And there's a simple way to deal with it. Ozempic and Mounjaro are highly effective medications for weight loss. However, a significant side effect of these drugs is the loss of muscle mass along with fat. Now, this muscle loss is not just a cosmetic concern. It can negatively affect your strength, metabolism, mobility, and long-term health. Fortunately, the side effect can be minimized or even reversed with proper resistance training. Having adequate muscle mass and strength provides several important health benefits. Having functional muscles could reduce the risk of falls, stronger muscles, improve balance and stability, significantly reducing the risk of serious falls, especially as we age. Improved daily functioning. Maintaining muscle allows you to perform everyday activities such as climbing stairs, carrying groceries, getting out of a chair, or playing with grandchildren with greater ease and independence. Improved metabolic health. Muscle is high metabolically active tissue. It improves insulin sensitivity, helping your body regulate blood sugar more effectively. This is particularly valuable when using GLP-1 medications like Ozempic or Mounjaro. In short, preserving and building muscle supports a healthier, more resilient body during and after weight loss. So what about ordinary walking? Is that enough to preserve or build muscle? Many people assume that walking, light cardio, or general daily movement is sufficient to protect muscle. While these activities are a good starting point for someone who is not accustomed to exercise or who is coming back after a long layoff, they're not really challenging themselves enough to preserve or build muscle during significant weight loss. Your muscles need significant resistance and progressive overload, which means gradually increasing the level of resistance to stay strong, and without this stimulus, muscle loss is much more likely when taking these medications. So let me talk about the benefits of proper resistance training. Resistance or strength training involves the exercises that make your muscles work against a force, such as weights, resistance bands, or body weight exercises. When performed correctly and progressively, preserves existing muscle, helps to build new muscle, improves strength, bone density, and metabolism. It also enhances your overall body composition during weight loss. And the best part is you don't need to train like a bodybuilder. Most people only need 1 to 3 sessions per week of structured resistance training, focusing on the major muscle groups. The goal would be functional strength and health, not the extreme size that professional bodybuilders possess. A common concern is that resistance training or weight training will make someone look overly muscular or bulky. This fear is basically a myth. So, the extremely muscular physiques commonly seen on social media and in fitness competitions are often the result of performance-enhancing drugs, very specific protocols, and sometimes years of dedicated effort. The average person who trains with weights 1 to 3 times per week will add muscle mass, but not to the extent of those who use performance-enhancing drugs. So, what is the takeaway message here? If you're taking Ozempic, Mounjaro, or similar medications, incorporating a proper resistance training is one of the most important steps you could take to protect your health and also to maximize your results. It helps you to lose fat while keeping and even building the muscle that supports strength, mobility, and metabolic health. So, we strongly encourage all of our patients to include resistance training as part of any weight loss program. And if you would like to get more information about our services, you can call or WhatsApp us today at 747-5297 or 308-3370. We are Progressive Health Services and we are located at number 4 Chincuna Gardens, Chinchin Road, Cunupia.